Welcome back to part two of my interview with Dr. Lisa Hamilton. In this episode, Dr. Hamilton shares specific new treatments she uses for treating dry eye disease. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube movies and shows. Let's talk about how you diagnose dry eye. You talked about the meibographer, and that you take a picture of the meibomian glands, the tubes that produce the oils, and to see if they're damaged or not. But how about you use a questionnaire to start off with?
Yeah, so what we do in our office, and there's no right or wrong way to do this, but what we do in our office, we have a practice that we do at least half of our exams that we see are routine vision exams. So what we do with our routine vision exams is I don't do a major questionnaire like a speed test. I will do that at the dry eye workup specifically, but just initially I want to make sure that I'm asking all of my patients, how are your eyes feeling? Are they becoming red? And I don't really try to ask yes or no questions. It's more open-ended. I know that it is happening. The question is, how often is this happening? At what time of day does it happen? And how severe is it? And how much is this affecting your life? And then I'll put some dyes in the eyes to look at how long does it take the tears to evaporate. The other thing is, when the tears become salty, the epithelial cells on the surface of the cornea, they sort of have this mortar between them, and the salt will erode that. And so when I put this dye in the eye, it's called fluorescein, it will stain any areas where the mortar's kind of been eroded. And then we also put a green dye in the eye called lissamine green, which will stain devitalized cells on the cornea and the conjunctiva. And we look at, so basically it's kind of two steps. I just sort of ask all of my patients, are your eyes dry? And I look for symptoms of dry eye. And really, when I really dig in and ask, like I said, about 50% of my adults are like, yes, I do have that. And so then I recommend that they come back for a full workup. And that full workup usually goes through their medical insurance. And at that point, we are checking the meibomian glands. We're documenting those with meibography. If they have significant atrophy on the lower lids, we'll want to flip the lids and look at the upper lids. We also have tear film imaging in the office, which will tell us how many seconds does it take for the tears to evaporate. And it's we want to get a baseline of that so that we know if we initiate treatment, how much are we improving the situation. We look at the oils. Some of them will, one of the ones that we have in the office will analyze how much oil is in the tear film. But either way, critical things are, what do the glands look like? And then we actually push on them with a little device to see how much oil is coming out of them. And then what is coming out? Is it clear or is it cloudy? If it's cloudy, but I can still get something out with a manual press, I'm happy. I know that this person is going to respond really well with LipiFlow. If I can't get anything out at all, if that oil is so concreted in there, I'm concerned that even if I do a LipiFlow, we might not get it fully dissolved and cleared out of there, and this person might be looking at multiple treatments. So I try to set the stage for that so that we don't do one treatment, have it not work, and then I didn't meet the patient's expectations. The other things we look at are, we check for something called lid light closure, where we just basically have a patient close their eyes and we hold a really bright light to their eyes called a transilluminator, and we look for any light leaking around the edge. That just means this person doesn't close their eyes completely. Think of a Ziploc bag that you've used over and over and over again, and then over time it just doesn't seal as well, and that will cause some mild dryness overnight while people are sleeping. And then some people, even their eyes gape open completely when they sleep, and that's called lag ophthalmos. That will cause severe, just think of like chapped lips, that'll cause a severe strip of chapping across the ocular surface. So we look for lag ophthalmos, lid light closure. We put the vital dyes in, the lissamine green and the fluorescein. With the lissamine green, we look for staining on the white part of the eye, the conjunctiva, which indicates devitalized cells. And then we look for any staining along the lid margin. I look for that biofilm buildup, and there's something called the line of marks, and look for where is that relatively over the opening of the oil glands. We look for friction marks, because if basically as we blink, if there's not enough fluid there, we get more friction when we blink, and the eyelid can actually start to get really irritated and can start staining in areas where the cells have been rubbed off from friction from blinking. So we look at the that's called lid wiper epitheliopathy. We look for LWE, and then we put the fluorescein in. We look for the tear breakup time. We look for the tear volume, tear lake height, and we have also a device that can measure this, but we can manually eyeball that pretty well with our slit lamp. Like I said, we check the meibomian glands in all 3 quadrants of the lower lid and count how many glands are pooling. I usually have a scribe in the room because we're checking so much stuff, and I'm calling out to my scribe, and she's documenting it. And we even got a new slit lamp, which is really cool. It's called a Firefly, and it's got a really nice video system built in, so I can record all of this as I do it and actually show the patient what I'm seeing. And then obviously we look at the lid margin and look for any sign of blepharitis infection. And then I can show the patient if they've got that waxy buildup from Demodex. And then we sort of create a treatment plan and try to set some realistic expectations, and that we're going to be seeing each other a lot for a while.